And there's this sculptor named Kenneth Snelson who uses a lot of these principles, but you can kind of see these are what's called compression struts. They're not actually touching each other. It's a little hard to tell in this image, but they're actually suspended within this continuous tension mechanism. And so you can create some pretty awe-inspiring structures with this architectural concept. And so we like to think of the spine that way. So the vertebra are these compression struts, and then the ligaments are these suspension wires. And so if you load a structure like this, because of this continuous integrity, it will kind of disperse the forces through that. And so our spine is kind of like that, which leads me to the other end of the spine, which is the head. So I think something that makes GEOs a little bit unique is the fact that we are trained in how to diagnose and treat the head. It usually requires training outside of just the first 2 years of medical school. And if I'm stretching the limits of your credulity at this point, let me know. I know you guys are integrative medicine, but it might still seem like a worthwhile question to ask how you treat the head. I think if we look at how the head originates, so Anoop, your daughter's occiput is still in 4 parts. And this area can undergo a fair amount of compression during labor and delivery, and inform, in some babies at least, how the occiput develops. And even in fully ossified adults like all of us, there can be a sense of compression across different areas based on the bone's history. We can kind of feel across the suture lines. So if I was feeling across someone's occipitomastoid suture, one side might feel denser or harder than the other. And then, there's different contact points, on the great wings of the sphenoid, on the rest of the calvarium, where we can also kind of infer what the way the bones of the skull bear strain differently, and what that does to the falx cerebri and the tentorium cerebelli. And so, elsewhere in the spine, we have the vertebra as the compression struts and the ligaments as the tension elements. And then, here, these would be functioning the way the ligaments do to kind of guide and limit the motion of the bone.